Hello, and welcome to our video on 10 common sports injuries that can end your career. As athletes, we all know that injuries can be a part of the game, but some injuries can be particularly serious and may even end your career. In this video, we'll discuss 10 of the most common sports injuries that can have long-term effects and force athletes to retire early. ACL tear. The anterior cruciate ligament is a major ligament in the knee joint, and a complete tear can make it difficult or impossible to continue playing sports at a competitive. Concussion. A concussion is a type of traumatic brain injury caused by a blow to the head or a sudden jolt to the body. We'll talk about the potential long-term effects of repeated concussions and how to prevent and manage them. Achilles tendon rupture. The Achilles tendon is the largest tendon in the body, connecting the calf muscles to the heel bone. A complete rupture of this tendon can be career-ending for athletes who rely on speed and explosive movements. We'll discuss the risk factors, symptoms, and treatment options for this injury. Rotator cuff tear. The rotator cuff is a group of muscles and tendons that help stabilize the shoulder joint. A tear in the rotator cuff can severely limit an athlete's ability to throw or lift their arm, making it difficult to continue playing sports. Herniated disc. A herniated disc occurs when the soft tissue between the vertebrae and the spine pushes out of place and presses on the nerves. This can cause severe pain and limit an athlete's mobility, making it difficult to continue playing sports. We'll discuss the risk factors, symptoms, and treatment options for this injury. Meniscus tear. The meniscus is a piece of cartilage that helps cushion the knee joint. A tear in the meniscus can make it difficult to move the knee and can limit an athlete's ability to play sports at a high level. Stress fracture. A stress fracture is a small crack in a bone that develops over time due to repetitive stress. Athletes who continue to train and compete despite a stress fracture risk causing further damage and may be forced to retire early. Plantar fasciitis. Plantar fasciitis is a common injury among runners and other athletes that involves inflammation of the plantar fascia, a thick band of tissue that runs along the bottom of the foot. Severe cases of plantar fasciitis can make it difficult to walk or run, forcing athletes to retire. Groin strain. A groin strain is a tear or injury to the muscles that attach the thigh to the pelvis. This can make it difficult to run, jump, or change direction, limiting an athlete's ability to play sports at a high level. We'll discuss the risk factors, symptoms, and treatment options for this injury. Shoulder dislocation. A shoulder dislocation occurs when the upper arm bone pops out of the shoulder socket. This can cause severe pain and limit an athlete's range of motion, making it difficult to continue playing sports at a